Female dog owners, especially dog breeders, you need to hear this. I'm Tracy from Grantham Breeder Services and I'm sharing my personal story of treating my dog's Pyometra without resorting to spay surgery. As a qualified veterinary nurse and an experienced dog breeder, I want to bust the myth that surgical spay is the only option for a Pyometra infection. In some cases, with a stable female and the right timing, Pyometra can be treated medically. I'm here to share the facts, so keep watching. Don't let an unsupportive anti-breeder vet pressure or frighten you into making the wrong decision. If you haven't seen part 1 yet, go and watch it now to catch up. So to start from the beginning, one of my homebred Rhodesian Ridgeback girls had her first season at 30 months of age. It was a very non-typical season. Instead of the normal 21 days, she actually bled and discharged for 42 days. At day 21 of her season, my intact male that I've got in the house, he showed interest in her, so we separated them for 8 days. Having reintroduced them after 8 days, he was not interested at all, yet she continued to still bleed and didn't really stop until, like I've said, day 42. This prolonged season concerned me greatly because her cervix was open for an extended period of time and that left her very vulnerable to an infection. Once the season finally entered, we fast forward 8 weeks. This girl appeared well, normal energy, good appetite, no temperature, no vomiting, no excessive thirst or frequency of urination, but something about her was just slightly off. For those who've never experienced this condition, severe symptoms can be feverish, quiet, no appetite. They often vomit. They tend to be very thirsty and urinate more often. They can also have a tender abdomen. There are 2 types of Pyometra. In an open Pyometra, there is a vulval discharge with the infection clearly free-flowing, and with a closed Pyometra, there's no discharge whatsoever. With a suspect case of Pyometra, what the vets will usually do is an ultrasound scan. That's the easiest way to confirm whether there is infection in the uterus. And just to be clear, for a dog that's showing systemic illness and life-threatening symptoms like those, then it absolutely is in her best interests to have a surgical spay. But if a female is well in herself and quite stable, then there is another way, so keep watching. Despite having the equipment myself to do an ultrasound scan, I chose just to book her in at the vet and discuss my concerns with the vet and let the vet give her an examination. I shared Crumble's full history and the prolonged season that she'd had, and that my concerns were she could potentially have a Pyometra or womb infection. My vet performed a standard workup, so she took her temperature, checked her heart, gave her a thorough examination, palpated her abdomen, and nothing significant was found at all. She checked for a vulval discharge and there was none. So what she concluded at that point was it was very likely to be a gastric upset, even though Crumble had no symptoms that were typical of a gastric upset. I had to be quite persistent and insist that they did do an ultrasound scan on her, because I wanted to rule out one way or the other. Were we dealing with a Pyometra, or was it a gastric issue? Was there no Pyometra? One way or the other, I wanted to be certain, but my vet was adamant she was too young to have a Pyometra, that the costs weren't necessary, but I felt they were. Crumble was taken through to the back for her scan, leaving me behind. When the vet returned, the diagnosis was exactly what I'd feared. She did have a closed Pyometra. And at that point, her uterus was dilated to 2 centimetres. The vet told me, because they had diagnosed a closed Pyometra, that they were prepping theatre to do an emergency spay on her there and then. I was quite shocked, and I asked her to stand her team down because I would not be spaying Crumble at that point, as she wasn't unwell at all. The vet went off to inform the surgical team. She was gone a little while. I guess they were having a chat. When she came back, she informed me that they would have to put a note on my records to say that I had refused treatment. She laid it on the line quite thickly, how I was risking my dog, how I was putting her life in danger. This wasn't the case. This dog wasn't systemically ill at all, and I felt there were other options that they actually weren't giving to me. She told me that a surgical spay was the only option in a case of a closed pyometra, and I knew this wasn't true. I explained I would be closely monitoring her, and if her situation changed and worsened, then I would be reconsidering surgery. I requested antibiotic treatment, which she was happy to prescribe, but other than that, she offered no other alternatives. As a knowledgeable breeder and veterinary nurse, I was really disappointed by this. I can only imagine how an inexperienced owner might feel pressured into making a decision without knowing all the treatment options. Why was I not given all the options that are available for treating a pyometra? I want to inspire and educate other breeders through my own experience and bust the myth that a surgical spay is the only option in a case of pyometra. I was keen to leave the vets. It was quite clear that this practice wasn't going to support me in any way with trying to keep a female within my breeding programme. I'm so grateful for this. I work with a reproductive vet in Chesterfield, and having left my local vets, as soon as I got in the car park, I rang him and spoke with him. I explained Crumble's history, the point we were at, and I asked him, could I try and treat this medically? Was that possible? To which he replied, yes, it's possible. Bring her to see me in the morning. Amazing. The following morning, Crumble was examined by him. She had all the usual checks, still had no temperature. She was very bright. But when they scanned her, her uterus is now dilated to 5 centimetres. Together we discussed the full medical protocol. He explained everything really clearly. He gave me all the options and he fully supported my decision. She received her first injection immediately. It was such a relief to finally have a vet who understood breeding, who respected my knowledge and offered real partnership and support. Be sure to come back for part 3 of this video series, where I'm going to discuss the treatment that Crumble had, how it went for her and the successful outcome. It might be worth saving this video because you never know when you might want to come back and revisit it. I just hope it might help somebody somewhere, and please share to any breeder friends who could also benefit from this information.